Welcome back to another clinical case review with the host, Dr. Chris Brown. I'll be going in on a upper cervical case I had with a patient who was dealing with bone-crushing headaches, as well as radiating nerve numbness going down her right arm. This was a really cool case because we had a lot of dramatic changes very quickly. With upper cervical chiropractic, really how people respond after their first adjustment falls into one of three buckets. First one, 80% of people, they don't really have a dramatic change. They get their first correction, they rest, get post-scanned, and then they're like, okay, that's it. Don't really feel a whole lot of change. Go the rest of their day, wake up the next morning, don't really feel a whole lot of change immediately. Reason why is because it takes a long time for nerves to heal. 10% of people, they feel kind of like sluggish, almost like they just worked out. They might be a little bit sore in their neck. That's because we just elicited a really big change that's going to work downstream throughout their entire spine and nervous system. The other 10% of people, it's like everything is gone out of the gate. And this is one of those stories. So this lady, she had come in, and a month prior, she had a fall, and she fell backwards off of her staircase. She tripped over her cat, and she hit the back of her head. And after that, she had essentially like post-concussion syndrome symptoms. She was having dizziness. She was having brain fog, super bad brain fog, really bad headaches that she said just felt like they were just weighing and crushing down on her skull or the top of her neck. And she also had some visual disturbances going on. She had like ringing in her ear. And then right when she came in to see me and get her first scan, she started having numbness go down her arm. And when I ran the scan on her, she was telling me about she had received chiropractic prior to this. She was getting full spine chiropractic prior to coming here. And she was asking me a bunch of questions, trying to get a gist for what these scans meant, what they are representing. And basically it got to the point where I had to actually explain some more in-depth science versus like analogies I tried to use to basically kind of bridge the gap between what I know about these scans and what people kind of understand just about the human body basics, because these scans represent a ton. Almost to the point where when we start explaining these and the neuroanatomy behind it, the neurophysiology behind it, doctors get left behind. So they're like, whoa, I've never known about this. So when it got down to me explaining the scans, I basically told her, this is essentially measuring function of your brainstem. Your brainstem is the fuse box of the human body. It has all of the control centers in the human body: your digestive center, cardiovascular center, respiratory center, hormone center, immune center, muscle tone center, sleep centers, mood centers. All of them are located in their brainstem. And to give you guys a little bit of a description of where that's at. So imagine my fist right here. Imagine my fist is my brain and my thumb is my brain stem. It sits like this in these two bones. So it's essentially like this. And then basically below my fist would be my skull. So basically like this, my thumb is sitting in these two bones right here. And that is what those two bones are protecting. And that's also what those two bones are influencing. So if we have any kind of pressure on our brainstem, then it's going to cause quite a cascade of neurologic output that's going to present as a myriad of symptoms, essentially. So when she said that, she was also in the decision of she needed some dental work done. And she asked me, she said, so what's more important right now, me getting this dental work done or me taking care of my brainstem? And I just kind of looked at her and I was like, what do you think? And she goes, for sure my brainstem. And I was like, yes, I think that this is a much more of a paramount issue. And the remainder of care, she's like, thank you for asking me that question. Because when I ran her scans, those first ones, they were essentially going off the screen, which shows a significant constriction of nerve flow and blood flow, which really explained why her right arm started getting numb nerve pain going down her shoulder, going down the back of her scap, her shoulder blade, and she hadn't had that before. in addition to all the headaches, she couldn't turn her head, the nausea, dizziness, brain fog, visual disturbances, ringing in ear, all that stuff. And when we, like I've said in other videos, run those scans, that tells me if there's dysfunction in the nervous system or not. If there is, we know that's due to a misalignment of the upper bone of the neck. And what we do to figure out what that misalignment is unique to that person, we go shoot x-rays. The x-rays that we do are fairly unique in that we do motion films that will actually show us how these bones are moving, because what causes those scans, what causes the nervous system to express dysfunction is incorrect movement of these two bones. So we need to actually assess motion objectively and be able to see how those bones are moving or lack of. So when we took her x-rays, basically neither of these bones were moving in any direction. They were just stuck. And so that's pretty much where it's like, hey man, just pick one and roll with it. And when I was essentially kind of looking at her x-rays, her head had drifted to the right, so it was a little bit of a translation like this. And then when she tilted her head to the right, her second bone would drift downward and rotate kind of into that right side, where we want it to go opposite. We want it to go opposite and rotate out. And so when I saw that, in addition, her second bone was rotated forward like this, which if I'm looking here, like that, and it was also not moving from right to left. So basically her whole complex had shifted to the right and was rotated, and nothing was moving back this way. So her adjustment ended up being that second bone on the right in between this big face right here and on this end right here, kind of right in the middle. And that would also address that top bone too, and this joint as well that was not moving. So after her first adjustment, her scan was pretty much right down the line. And the next day, or 2 days later, she came back. She's like, my numbness is gone, my neck pain is gone, headaches are gone. What did you do? And I was like, awesome, that's great. And I was like, no, just continuous bone pillow, drink water, prioritize sleep, nervous system's working right now. This is how our body heals itself. Just let the body do its thing. Just continue to optimize for that setting. Just be very relaxed and just let the body just start to do it. It's been supposed to do this whole time. And I mean, she had, her first adjustment held for about like 3-4 weeks. And a lot of stuff that she had after that fall, she had some issues going on prior to that fall, like neck pain. She had lower back issues for a long time, knee issues. And all that started clearing out. Things that she had for, 10, 15 years that she's been getting addressed. But she really responded super well to care, and for the most part, rode that for the remainder of the care plan. And the way that she describes is that after leaving this place, she feels like she's just like levitating. And she's been coming in consistently since then, due to her own election, because she's like, I understand what this is doing. This is managing stressors in my life. This is what the nervous system does, is that it integrates and adapts physical stressors, chemical stressors, emotional stressors, and tries to get that input expressed out and through of our body and be able to create us into a more resilient being. And she understood that from the get-go. It's like, this, if I want to continue to operate at a great level, this is where I need to be, and this is the kind of care I need to be getting and receiving. She was a jeweler, and she would man a pop-up tent, and she was getting to a point prior to care where that pop-up tent, the table, it was all like too heavy. It was jacking up her lower back. At the end of the day, her hips would get all torsioned up and twisted up, and she was having a tough time continuing to work a while. And since she was a jeweler too, and she was actually making her jewelry, her head would be down all the time, looking like this, looking through a really tiny kind of fine eyewear. And she said that after a long time, her neck would really start aching because of this forward head, trying to keep this bowling ball of a skull that we got upright. And as care went on, she stopped having residual issues from that, which is super similar to like a dental assistant, how that position might be, or someone who's on their phone all the time. she responded great from it. And it's been a super awesome story. I mean, for me, it was really cool because that was one of the first times where I had seen scans go off the screen. I was like, whoa. And to be able to correlate that with the numbness in her arm and be able to see that on the full spine scan, being like, this is why your arm's going numb. It's because it's literally not getting nerve flow or blood flow to it. And then to have that essentially clear up like that almost instantaneously, that was really cool for me. I was a young doc at the time. I hadn't had a whole lot of exposure to those kind of scenarios and those kind of scans. And to be able to have that kind of a dramatic change right out of the gate really just humbled me, not really knowing how much is involved with the nervous system, how it's going to respond out of the gate. But when we are able to do a really thorough analysis and this person's body is in a position to really integrate this stuff well, a lot of really awesome things can happen. So this is a case where brain fog, dizziness, vertigo, headaches, neck issues, lower back issues, hip issues, arm numbness, were all that stuff cleared up relatively quickly. And the only thing that she changed in her life was just getting her nervous system checked and getting this upper cervical complex adjusted when only absolutely necessary, and just letting her body do the work that it's designed to do all along, which is to heal yourself. Thank you.